seen delays of up to 5 days of people waiting to get their test results. We now hear that New South Wales health officials are taking more than a week to find exposure venues. You keep saying that we haven't lost control of this outbreak. How can you continue to say that when all evidence, the case numbers, infections in the community, delays, all point to the fact that you have lost control of this outbreak?
As Dr Chant reported a few days ago, and I'll ask Dr McAnulty to repeat that, on average it's taking around 28 hours for people to get test results, and sometimes people are getting their test results sooner than that point in time. There was an issue with one private lab, I understand, which Dr Chant reported have since been managed, but I will ask Dr McAnulty to talk about that. He's well connected, not just in relation to the pathology labs and the testing, but also in our ability to get those venues of concern. But as I said, sometimes we need to go back because people might forget or not provide information at the time, and that's why we ask everybody to be alert to those venues of concern. It's not because our contact tracers don't necessarily get to them quickly, it's because people remember things subsequently, or else people may not have known they were infectious at a particular point in time. But given the importance of the question, I will ask Dr McAnulty to provide a health perspective on what you've asked.
Thanks, Premier. So in terms of turnaround time, we have been working very closely with all the laboratories, public and private, to ensure that we've got maximised resources there to get test results as soon as possible. Positive results are fast-tracked, so we hear about the positive results much more quickly. Now, that's very important in terms of us being able to then contact trace. In terms of people remembering the venues they've been to, it does take a few interviews sometimes. We have a number of tools we use. We have expert contact tracers and epidemiologists who take people through their diaries, through their phone records and other measures to help them remember. But if you can imagine where you've been in the last 14 days, may be difficult to remember, particularly pre-lockdown. So we work with people. They do take time to get that information, and they do remember information afterwards.
How are contact tracers open though? Because I mean, there's so many exposure sites, there's so many delays. Are contact tracers now, have they lost it?
No, the contact tracers are doing a fantastic job. We've surged. Every time we have a surge in cases, we surge our staff. We've got people on call who come in, throughout the day. We keep very close tab on that workload. We've got, throughout this pandemic, we've improved our systems for getting on top of the numbers and the cases and making those phone calls and text messages.